Hey guys, my name is Ishrak.
My name is Asim, and we're from the KU Baba team.
Today we're going to be talking about breast and bowel cancer.
Ishrak's going to start off with breast cancer, so I'll just pop back in a minute.
What is breast cancer? Breast cancer is a malignant tumour that starts in the cell of the breast. A malignant tumour is a group of cancer cells that can grow into nearby tissues or spread to distant part of the body. Breast cancer happens mostly in women, but men can get it too. Breast cancer is the most common cancer in women. In the UK, around 50,000 people are diagnosed each year. You'll be surprised to know that 350 of them are men. Whether you're newly diagnosed, a long-term survivor, or still in active treatment, breast cancer can affect how you feel inside and out. You have to cope with the emotional strains of the diagnosis and the challenges of the treatment, as well as the stresses of everyday life. Even though your diagnosis may be similar to another person's, the way breast cancer impacts your life is unique. Generally at an early stage of breast cancer, it is usually easy to treat, may need less treatment, and is more likely to be cured. Current evidence suggests that breast screening reduces the number of deaths from breast cancer by about 1,300 a year in the UK. People suffering from breast cancer may not show symptoms at all, especially in the early stages. However, new lumps or changes in breast shape can be indicative of breast cancer. Other signs include nipple discharge, pain, and change in breast size. If you notice any of these changes, visit your GP. But remember, a regular self-examination should be carried out on your breast.
Hey guys, I'm back. Ishrak's done with breast cancer, so I'm going to start talking about bowel cancer. So, what is bowel cancer? Bowel cancer is cancer of the lower gastrointestinal tract, or more commonly known as the large bowel, which includes the colon and the back passage. Like breast cancer, there is a high incidence of bowel cancer too. Each year, around 41,000 people in the UK are diagnosed with bowel cancer, taking its place at number 4 among the list of most common cancers after breast, prostate, and lung cancer. Dealing with a condition like bowel cancer can be hard to cope with, both physically and mentally. The physical changes are likely to affect your emotions, leaving you upset, frightened, or even confused. You may even feel that things are going out of control. However, bowel cancer is treatable and curable, especially if it's diagnosed early. More than 9 out of 10 people diagnosed with stage 1 bowel cancer survive 5 years or more after diagnosis, and there is only a small chance that it will come back after 5 years. However, this drops significantly as the disease develops. The number of people dying of bowel cancer has been falling since the 1970s. This may be due to the earlier diagnosis and better treatment, hence it is important to act early. A few warning signs to watch out for are bleeding from your bottom and or blood in your poo, a change in your bowel habit in the last 3 weeks or more unexplained weight loss, extreme tiredness for no obvious reason, and a pain or lump in your tummy. The national screening program for bowel cancer in the UK is offered from the age of 60 to 74, which involves a fecal occult blood test. This test investigates the presence of blood in stools. A one-off bowel scope screening test is usually offered to men and women over the age of 55, which involves a thin tube with a camera that looks inside the bowel.
Prevention is all about maintaining a healthy body.
Some of these include, if you're a smoker, cut down the number of cigarettes you smoke. This will significantly reduce your risk. Reduction in alcohol consumption, ensuring that you do not exceed 14 units a week.
Also, studies have shown women who breastfeed are statistically less likely to develop breast cancer than those who don't. Having a diet rich in vegetables, fruit, poultry, fish, and low-fat dairy product has also been linked with a lower risk of breast cancer in some studies. And most importantly, make sure that you exercise 150 minutes per week.
Hope this video has made you more aware about breast and bowel cancer.
For more information, please follow us at KU Baba on Instagram, Facebook, and Twitter.